Some of the most unheralded people are the ones who are on the ground, who are the first to respond to a medical crisis. They're the EMTs. And we have one particular story about an EMT in Edwall, Washington, who finds a lot of gratification in her work.
Welcome to Edwall. Population roughly 250. People come here for the quiet country lifestyle.
I live in this community because I love it here.
Tucked away on the Palouse, you are miles away from the hustle and bustle of the city, and in an emergency, miles from critical medical care.
Helicopter is our closest advanced life support.
Bridging that gap, dedicated volunteers like Sue Lani Madsen, wife, mother, architect, and emergency medical technician.
I've been involved with the fire department for 15 years as a first responder and then as an EMT, so I've been an EMT for 12 years. It is a job. It's just a job that isn't paid in the same way as other kinds of jobs.
A job Sue Lani takes very seriously. As an EMT for Edwall Fire and Rescue, she has to be ready at a moment's notice to grab her coat and head to the station.
You have to be able to allow that kind of disruption to be able to cope with it. I jump a lot less than I used to. At first it was a big surge of adrenaline. Now it's a little surge.
Sue Lani and the other EMTs in her fire district are often the first ones to show up when someone calls 911 with chest pains, a cut, injuries from a fall, a car wreck, you name it.
We can offer some important treatment, and one of them is to help people remain calm, keep them warm, control bleeding, splinting, provide oxygen. We've got the defibrillator paddles. We can take care of the immediate threats to life and limb.
Sue Lani can't transport patients, so if a call is serious, she must wait for more advanced medical help to arrive.
I'm very aware of how limited our skills are and how limited the range of treatments that we can offer.
Limited, perhaps, but vital. In small towns all over eastern Washington, volunteers like Sue Lani are on the front lines of emergency medical care. Volunteers are about the only option.
There's no way that our tax base could support a full-time paid staff for fire and EMS response, and so we rely on the volunteers.
And these days, it is getting tougher to find them.
A smaller pool of volunteers to recruit from, fewer people who are around during the daytime to be able to respond, just trying to find people.
With an ever-shrinking pool of potential volunteers, it is a constant challenge to provide 24/7 coverage. But Sue Lani isn't worried about the future.
I'm an optimist, and I think that we will find a new generation, and we're starting to have some, a little bit of young blood coming into the fire department, and it's really appreciated.
For now, Sue Lani has no plans to turn in her hard hat.
I'm going to keep doing this. I still can, and it still is a need, so I'll keep doing this.
She wouldn't have it any other way. It's her duty. It's the price she pays for living in paradise.
We all have our place to contribute, and this is where I feel like I can contribute.